Good evening, ladies and gentlemen. Well, I'm saying good evening in South Africa, but in America, it's still good morning. So good morning, good day, good evening to everybody who has joined us from different parts of the world. My name is Dr. Fundi Lenyati. I'm the host on the Dr. Fundi digital channel. I'm from South Africa, Johannesburg. Today, we are hosting a home girl who is in the US. Her name is Professor Amanda Otter. Professor Amanda Otter, Lizizigazi, here in South Africa, we use clan names. We put a lot of weight on the clan names that, people, have. Sometimes even more than the surnames. So Prof. Otter was born and raised here in Port Elizabeth. She graduated from Temple University in Philadelphia, attended Wilmington University where she received her Doctor of Education degree. And she also received a certificate in professional development at the Leadership Institute. She's got such a long CV. I'm not gonna read all of that. Safe to say that she's somebody who's not lazy to sit behind the desk and burn the midnight oil. But one thing I need to say about her is that she's got, passion for the development of young women, especially when it comes to them studying STEM subjects, science, technology, engineering, and maths. So she's done a lot of work in the community and also bridging the gap between the communities and secondary and tertiary institutions. So that's something that's very, very close to her heart. She is an executive board member of the Chosen to Care since July 2019. She's also been the president of WAUW. I don't know what that is. You're gonna tell us what that is. But something that I'm proud of is that she was a volunteer on the Biden campaign. And also she now is joining or has just joined another campaign. She will tell us a little bit more about that. Governor Murphy or something like that. She did so well with the Biden campaign, representing Africa and diaspora in that campaign to make sure that their interests are taken care of to an extent that she was approached to be part of the Murphy campaign. So welcome, Zizigaz.
Thank you, Doc. Thank you for a very long presentation. Good morning, everyone. Good evening, good afternoon, wherever you are. So I'm not going to introduce myself because Doc has already done a great introduction, and every single, statement that he has said, I echo it. And I'm very, very excited to be here today. And I've been communicating with Doc with all my experiences, and sometimes he'll also budge in and do a research when we need information about South Africa, especially during the campaign. And, he has just been one person that I've always relied on when it came to information. And I mean, I don't know if you remember, forgot, Doc, we also did, the youth during Black Lives Matter and the election that was taking place in 2020 with the. So we have, collaborated, with Doc in so many, levels. So as Doc has said that I'm very diverse and I get my hands on dirty onto any single project as long as it's within my, ethical, beliefs. And today's actually interview is about, the pandemic, the vaccine, the new administration, what are they doing, what they're not doing, and also just, the state in the United States. Are people going through, the fears, the whole dynamic of what is going on in the United States.
Yeah. All right. So just to kickstart our discussion, Amanda, do you mind if I just call you Amanda? And
sure.
We don't use the prof and the speak? Just say,
Yes.
Amanda. You good?
Yes.
All right.
Yes.
Okay, so you know, as I was preparing for this discussion, like you said, we're really just going to focus broadly on the pandemic, the COVID-19 pandemic, the fact that America has got just over 25% of the load of confirmed cases in the world. That is 25.8%. About 26 million 512, 193 people as that last night were confirmed to have been diagnosed with COVID-19 in the US. In terms of the deaths, 447,459 people had died across the US from COVID-19 related, complications. That death rate is actually about 1.7% of the total number, So if you look at it in terms of the death rate, it's still below 2%, as compared to us here in South Africa, where the death rate is actually at 3%, But when one also looks at the people who have recovered in the US, the recovery rate has been pretty low at about 61.1%, whilst here our recovery rate is somewhere, in the late 80s. So that's just a little bit about how big the challenge is in the US. So with that introduction, Amanda, can you just tell me, as somebody who is in the US, in the state of New Jersey, somebody obviously who keeps track of what's happening across the country, when we look at these numbers and the load of COVID-19 in the US, it's scary. Can you just tell us, as people who are there, how scary is it, to be in a situation where there's so much of people who are confirmed or who have been confirmed to have COVID-19?
So, look, I'm just going to start with my state, and then I'll speak about the United States in general. In my state, I'm in New Jersey, as you had stated, and it's with a Democratic governor, Governor Murphy, who is actually going through the re-election right now. So we are actually doing everything that we can to literally prevent, and we are practicing prevention, because that's actually the key. Because, it's tough to trace, where, the citizens actually get the virus. So the only thing that we can do is to prevent. So there are so many measures that are in place that the governor has put, where our schools are actually operating remotely. And, so when patients are going into the hospital, no visitors are allowed. And even if you're going to the emergency room, your companion cannot go into the emergency room with you. And they are now in every single, public place or stores or malls. When before you enter, you have to sanitize, mandatory mask, no matter what, you cannot enter. So those are, the measures that we're putting in place that have been, been in place. And now, because things are actually mandatory, especially under the new administration, who actually believes that the virus is real, and mask saves lives, and also just the whole interaction with human, like the numbers being limited for the the gatherings. So those are also some of the things that have been actually enforced.
Yeah. Would I be right then, just from the little that you've told us now, there seems to be differential approach, or at least in the recent past, there was a differential approach state by state in terms of the response to this COVID-19 pandemic? Because you are telling us the picture in a democratic, what do you call it, Democrats-controlled, state. Does that mean in
versus the
states
Republicans?
where that states that are controlled by Republicans, things are slightly different?
Oh yes, definitely. In some of the states that that are Republican governed, there are no masks, requirements, and also most of the the public places are opened, the restaurants are opened, and also just the whole status is actually different from the Democrat states. Not to say that all the Republican states are operating that way, but in states like, and I'm going to call them out, in states like Texas, Michigan, in Texas, we have a Republican, a governor. And then in Michigan, we also have a Republican governor. But, the whole dynamic is completely different. In Texas, they've opened after the lockdown way earlier than the rest of the states during, the lockdown. So the whole approach is completely different. And the numbers are also they vary from state by state in terms of who's affected and the number of deaths. Florida is actually on another level, and that's a Republican state. The numbers are off the chart. Yeah.
All right. So, but that is what was happening before. Now you have a new sheriff in town. Well, not sheriff in the true sense of sheriff. You've got a new president who has a different approach. So are those Republican states still, doing things the way they were doing before?
So let me start with, you mentioned that, we have a new administration. Leadership is very, very important, and how leaders portray themselves. We had a leader that did not believe in the masks, in wearing masks. And also, sometimes we'll see him addressing hundreds of people without wearing a mask. I have never seen President Biden in public without a mask. Let's start right there. The leadership on a federal level is completely different from the previous administration. So you've asked me, are those states still operating the same way within the new administration? So, if we have to reverse, the Biden administration didn't have a transition period, which starts from the time that he wins the election all the way until inauguration. So right now they're actually going through the transition period, and people are waiting and they're watching, and the critics are also not as harsh to him because they're giving him the opportunity, and his whole his number one goal is to literally deal with the pandemic, because as we can see, the stock market is at a dead still. It keeps on going down. Students are not going to school. Every single public and sports is not taking place. As you know, that the United States, we are big in sports, basketball, football. Nothing is taking place. So, and it has affected so many people in terms of the economy aspect of it. So the leadership that we have is actually setting up a great example for the Democrats and the Republicans. And you can say that, oh, we have a new president, but how he's approaching this pandemic is actually a format that, and also how he addresses people, it's very professional. It's, it's very, humbling. And so people are actually listening, and people want to get better. People want the pandemic to be over. So they are listening to him, and his whole, strategy is, very, very well received.
All right. I'm going to ask you a question here. Obviously, we on this side of the Atlantic, we looked at you guys going through your elections. There were record numbers of people who were voting that side. Even the losing candidate had the highest, second highest votes in history. When I say second highest, because his numbers were even better than the numbers of former President Obama. And if there wasn't a Biden, he would have still, the numbers that he had were actually good numbers. But so you've got so many people who were behind the former president, but obviously there were more people who voted for the current guy, which is President Biden. Now, in such a sort of divided kind of country, do you think it's going to be easy to get this unity in action towards fighting this pandemic?
So for me, during the inauguration, and actually any time when I'm watching the news, I watch CNN, MSNBC, which is dominantly for the Democrats and also very progressive, and then Fox, which sides with the Republicans. So I watch all three stations, and sometimes I watch more of the Fox to hear what they are saying. There was positive, messages that were coming from the Fox commentators, and they were very pleased with his speech, his presidential address, and he's really trying to unify the country. He is. And I understand that the country was divided, and also, people wanted, President Trump to get his
second term.
Yeah, for the second term. But, in all of that, we are just, grateful that we have a president who it's not only about just winning, winning and how do we move forward, and number one, challenge is, the people that didn't vote for him. But when he addressed the country, he said that he would work harder for the people that didn't vote for him, and represents them, in a very professional manner, and also combine them, because he says that he's not the president for the Democratic Party, he's the president of the United States of America as a whole. So, he is reaching out to the Republicans, and also another thing that he has done, which, has never happened, he's kept some of the, employees that, were Trump, under the Trump administration, which that's also one of the, formats of, saying that I am the president of the United States. As long as you are doing the job, adequately and, professionally, and you are doing what you're supposed to be doing to represent the country, I'm not gonna let you go, So, and also if you look at his cabinet, it's a very unified cabinet. The Minister of Defense, was greatly approved by, the Republicans. And as you see that the approvals and the confirmations are going smoothly, because Biden has been in politics all for many years, and he knows how to unify just the capital capital building, and he worked with so many of the senators and the states, Congress people. So, we actually got a perfect president to do the job the way that, to unify the country, because that's the number one goal,
So, do you think when it comes to fighting this COVID-19 pandemic, there's going to be a pulling together towards the right direction, or there's still going to be politics that will sabotage, all what is being planned, because now my understanding is that there's now some central, strategy and and governance direction around how this thing must be dealt with, within obviously the federal state. So do you think that there is going to be a pulling together as far as COVID-19 is concerned?
I truly believe so. I mean, we're talking about lives, people's lives. We're not talking about the stock market. We're not talking about, anything else. We're talking about people's lives. Although you are going to have those people that, will not want to take the vaccine, people that, don't believe, that.
We're going to talk about that. We're going to talk about that. We're going to talk about
Yes.
that. All right.
Yeah. And
So the sense I'm
in
getting.
general, it's good. There's going to be a higher percentage. I mean, look, every daily there's like 1.2 million dosages that are being, administered.
Yeah, you're moving ahead of me now, Prof. don't move too fast. I want us to. We're still trying to look at this elephant, and see. It's a big elephant. It needs to be chewed, in a strategic way so that there is progress moving forward. So you are basically telling me that there is a move in the right direction, and more people are going to join that direction so that the interests of the country, as far as dealing with the pandemic, they become the number one priority, so that the economy, the schools and everything else that has been affected negatively by the pandemic, are actually back to, something close to
operations.
To operations. No, I'm glad to hear that. Now, there are people like Dr. Fauci. Is it Dr. Fauci? Yeah.
Dr. Fauci.
Yeah, who have been quite prominent in the COVID-19 response of the USA before the new president. But he is still,
the advisor,
playing a positive role even now. Can you just comment to me about that?
So, well, and I'll just speak for, the population that, really believes in, the, research and correct news. For me, when I read my news, I read them from the, NPR, which is the National Public Radio. And very, like unbiased, and they report the news, that are, in an unbiased, format. And it's just, a radio station that, has been very well respected. So Fauci, if you listen to Dr. Fauci, you would see that every single prediction that he has, made has actually come to place. Last year when he would say that, in July we would reach these numbers, in September we would reach these numbers, most of the time we would even surpass those numbers. I remember when he said that in July, last year in August, we would reach 500,000. I mean, I said, that's not possible.
Must be smoking something.
Yes, but guess what? We are actually at like 589, And another thing that, that's still, I remember very well. Last year, August, Dr. Fauci said that we will be at a better normal standards operations summer of 2022.
Yeah.
Which is June, July, August of 2022.
Yeah.
And just with the rate that, this COVID is going, and, where we are right now, I truly believe that. So Dr. Fauci, is, the director of the National Institute for the Infectious Disease. And this is what he does every single day.
So he's a true and true scientist.
Yeah, he's a true and true scientist. And, before he says anything, he says it out in facts, and he doesn't just say things out of his brain, and he doesn't say things out of, what somebody else has said without, proving it. So
therefore,
he love Dr. Fauci.
Yeah, so he is a scientist. He believes in science. I mean, I listened to him yesterday because remember now, there is this thing that is called the South African variant. So yesterday there were 2 cases in the US. The first 2 cases that have got this B501 version 2, which is called the South African variant, at different sides of the US. And he actually spoke about that. But also, he also spoke about the fact that 2 vaccines, the Johnson & Johnson one and the Novavax, are actually starting to show that they are not so effective when it comes to this new variant. So it sounds like somebody who is very, very much,
knowledgeable.
you know, a scientist, and he doesn't really focus on who is the politician, you know, at this point. And he actually was jointly rewarded or recognized with, you know, the chairperson of our own ministerial advisory committee on COVID-19, you know, Professor Abdul Karim. So yeah, no, I wanted to just check if with the change in administration, did they discard him and brought somebody new,
No,
or actually they kept him so that there is institutional memory and, you know, you don't start things from afresh?
no. So let me just say, in the previous administration, he was not the advisor. He would just, you know, make his comments and advise the country. But now he's an official advisor in the Biden administration under the COVID-19, you know, committee. So he is actually, yes, yeah. Okay. And you know what? Anybody, when they are talking and they are making comments about, you know, the pandemic and the vaccine, they always quote Dr. Fauci, what he said. They always quote Dr. Fauci. Yes.
All right. Okay. So, but then yesterday, as I was listening to one of his press conferences, and you see some of the comments on social media, there was also a lot of hate. There's people like he's lying, and lying. So are you saying these are the remnants of the guys who are fake news guys? You know, because there was a bit of hate that I was seeing there.
So you know, remember how the previous administration, you know, if Dr. Fauci says something that, you know, is against the president, you know, people would, you know, comment. That is something that has always been happening, and but that's a small percentage, though. That's a very small percentage. And I mean, you're not going to please everybody. You're not going to have, you know, the full crowd of the whole. I mean, the United States has 331 million people, according to the US Census of 2020. And, you know, I mean, I can, you know, as long as, you know, the high percentage of the citizens, you know, are actually believing in him. Hey, there's so many conspiracies. There are conspiracies that, you know, Dr. Fauci said it out in public that masks save lives. They protect you. And there are people that say, no, that's not a proven research.
Yeah. All right. And then I'm going towards the vaccination thing, but I'm just taking a detour on a few things relating to COVID-19. Here in South Africa, over the past, I would say 2 months, there has been very strong lobby groups, you know, who've been putting pressure on our regulator that is in charge of licensing medicines. There has been this drug called ivermectin, which is a drug that is actually used, it's been used for decades for treating worms in animals. But it's also licensed to treat complicated worm infections in human beings. So there's been a lot of people starting there in the US, a certain Dr. Corey, who have been, you know, presenting to your congresses and whatever to say they must allow this drug to be used because it prevents COVID-19 and also it is a treatment for COVID-19. He was pleading with your, I'll call it legislator, or I'm sorry, legislature. So here in South Africa, we then have been having a similar situation where some of the medical doctors have actually been part of that lobby group who have been putting pressure on our regulator to actually license this thing. Yet scientific evidence on safety and efficacy is not convincing. Hence, on the 6th of January, you know, our regulator said, up until there is convincing evidence, we are not going to, you know, to approve this thing. But then guys in this lobby group here in South Africa, Frontline Doctor Grouping, have been using information coming from the US, quoting this Dr. Corey, and the fact that the standing of this drug within the US has been upgraded to a situation where the authorities are neither for nor against, this drug. So I thought maybe you could say something around that, but maybe it's not something that has come, your way.
Well, I mean, just from the little bit that I know about the drug, don't see any correlation, because the COVID attacks your lungs first, and so the worms aspect of it, don't
No,
see.
it's been found to have some antiviral,
Oh, okay,
anti-inflammatory
antivid.
properties.
Okay,
All right.
antivid.
So because there hasn't been a cure against COVID-19, a number of people have been looking at using drugs that are existing and repurposing
Okay,
them.
antiviral. Okay.
So those with some antiviral properties and whatever have been tried. And so this has been the wonder drug that many have then been talking about, but science has not been backing that up. But let's move from that. All right. So you have then a situation now where you've got a new administration. One of the things that the new president has been talking about ever since he had won the elections was how he was going to scale up all interventions, including vaccination. So, and he started talking more about that, even before he was inaugurated. So, can you just tell me, since he got to office, what is it that he has done to try and scale up and improve the response of the US as far as COVID-19 is concerned?
So, and I'll just touch on actually what when they got into the White House, there was no plan that was left for them. There was no pandemic plan. That
But
just
there was a letter there that was written there that says, Joe, I
won.
won these elections.
I won. Hey, I don't know what's the truth. I mean, but you know what? Just to put in some humor, people are, like at home, stressed and all. So that was very funny. But so, the Biden administration, they expected the worst, and they pre-planned. And, that's why, President Biden, when he won, he said that he was going to keep Dr. Fauci, to surround yourself. I mean, he's not a scientist, he's not a doctor, but it's very important that you surround yourself with people that, are experts in the field. So when he came into the office, he literally worked with all the experts all over the country, and he reached out, to the medical groups that, state by state, and also the governors. Some of the governors in the Republican states, they also joined in. I think there were only just 2 states that didn't join into that, but now they're all in. So also what we found out was that there were no vaccines that were ordered, and there were also no vaccines that were, ready in terms of, for the phase 2, because, Pfizer and, okay, I guess we're going to go.
Yeah, we'll get there. We'll get there.
All right. So he had to put so many things in place, but, he was ready for that. He expected, that, he's not going to get any transition, documents, so that's why he started before he got into the office. And, he actually had a strategy that, was created to, make sure that, the healthcare workers are the ones that are vaccinated first, and then go into the 65 and above, whether they have the symptoms or don't have symptoms, whether they have sicknesses or they don't have sicknesses. As I had mentioned before that, there are 1.2 dosages that are, being administered daily. So, every single thing that he's doing daily, has improved. Whatever was, implemented yesterday is way better than what is being implemented, today. And they're working 7 days a week.
All right. Before we go deeper on the changes you know, in terms of the direction and also the speed. I just want to ask you, and I'm playing a devil's advocate here. Now, during the time, I mean, the biggest hope in turning around things against this pandemic has been the development of vaccines, right? Because there is no treatment anyway. Right. So now, as early as the first quarter of last year, there was this thing called Operation Warp Speed, OWS. And this is, you know, something that was announced officially on the 15th of May last year. You know, and this is really about facilitating the US government, facilitating and accelerating the development, manufacturing, and distribution of COVID-19 vaccines, therapeutics, and diagnostics. Now, this was done during the Trump era, and it was funded initially with about 10 billion US dollars under that CARES Act. So when one looks at that, then you say, oh, okay, but there were some good things that did happen under the Trump administration, as far as, you know, putting things in place for vaccination, funding organizations to, you know, like Moderna to come up with this vaccine. So was it that bad when it comes to COVID-19?
Look, I'll say this, you know, without, you know, crushing anybody, President Trump did, implement, some, resources. And, I mean, for example, he was the one that sent in the military to New York when, the pandemic was like hitting New York, 5,000 cases daily, people that were dying every single day. And Operation was the one that, was actually working in terms like on the ground with the grassroots, turning stadiums into, like the resources where, people, and then they had the beds, and all that. So he did do, something, and that is needed by the president, the one that has to approve that. And, there was no other option. And, he had to do that. And, even though, in the United States, we say President Trump was the worst president ever, he did so many good things. I can say it for myself, that, in terms of, like, for instance, just before he left, he wanted to approve, a $2,000 check, for, over, the $600, checks to the citizens.
Give to the people who are unemployed and stuff.
Yes, yeah. And I mean, so when you get to the nitty gritty and dissect, there's so many things that he wanted to also put in place. It's just that his delivery sometimes, and also his approach on things, I always misscrewed. And I have so many policies that, I mean, maybe people will start hating on me right now, but,
yes.
There are policies that were beneficiary to, that benefited people. And the only thing that I didn't like, though, is that, he's an egocentric and a narcissist. He actually, in the checks that he gave out, well, not gave out, that were issued last year, he signed his name, Yeah. So people were confused, thinking that the checks came from Trump, while, they actually...
That sounds like some of the countries here in this continent,
Yeah.
When people think that the grants, disability grants and old age grants are coming from whoever is the president at the time, rather than the government.
Yeah. So and as you know, the federal system in the United States, you as a president, you might say that this is what I'm going to do. If the Senate and the House do not, sign off on that, that doesn't take place. So there are so many, resources that he wanted to put in place. It's just that when he puts those resources in place, everybody gets to hear about them, and then he rubs it onto everybody's face. While that's the benefit of the country. But you know, altogether, you know, the operation that was in place during, you know, his presidency, and it's still operating up till right now. He, you know, needs to get credit for it, and I give him the credit for it.
Lovely, lovely. Now let's come back to now the issue of um, vaccination, what we call vaccine hesitancy across the world. There are people who have said, for religious reasons, I am not going to take this thing. Others, they believe in conspiracy theories that, you know, this thing, the 5G, what. Others, they think the vaccine, there's a chip that has been put there by Bill Gates and Melinda Gates. You know, there's so many conspiracy theories that are circulating in the social media, you know, across here in South Africa, and I think in the rest of the continent. And all of them, you know, there is this thing, misinformation and disinformation. Misinformation being just somebody who's sharing information that is not true, but disinformation being deliberately misleading people, giving them wrong information because you want them not to participate when the vaccination program comes to play. So how are things in the US, maybe in the state that you are in, as far as these conspiracy theories, the 666 things from Christianity, that is going to affect one's DNA, and all of those things, which are meant to discourage people from volunteering to be vaccinated?
So they actually exist here in the United States too. And I'll just start with, you know, the African-American population. You know about the Tuskegee, you know, history where it happened in the South, where there was, if you read about it, the Tuskegee history, where, you know, there was a group of white folks who, you know, I know that they injected, you know, African Americans, and, you know, hundreds and thousands of them died, and so people are still thinking that that goes under that, you know.
So basically, there are trust issues that this could be another way to decimate the black we'll call it
African Americans.
Yeah.
So and also there's so many conspiracies, and for me, I'm just going to speak about what I believe, and also what, you know, my, you know, thoughts about the vaccine. That's what I'm going to share.
Yes, I don't want us to spread any conspiracy theories. I just wanted to know, how big is the problem? Is there a lot of hesitancy?
There. And you know what? And you know what, Doc? Now pastors, you know, from the African American churches, they're actually preaching and, you know, educating their, you know, their followers that, you know, go ahead and take the vaccine. It's safe. And they are also in the local news, you know, saying, you know, preaching about, you know, what are the advantages of, you know, taking the vaccine. So you know, and also the community leaders too are also doing the same thing. So the good thing is that at least the leaders, you know, believe that, you know, all those conspiracies, you know, I mean, you know, you say that, okay, this is a conspiracy. Has that conspiracy been proven too? You know, so you have to, you know, show also evidence on that conspiracy, that what you're saying is actually true. And
yes, no, but you know what they normally do when they come up with conspiracy theories? They take a little bit of the truth, and then they package it with a lot of untruths, you know. And if you don't come from that field, you know, if you don't have depth in that field, like in medicine, then it may not always be easy for people to understand. For example, the two vaccines that you guys are using there, which is the Pfizer BioNTech and the Moderna, they are actually making use of the new vaccine technology called the mRNA vaccine technology. Now, obviously, an RNA, you know, then they see, oh, so this RNA is going to go in and get into somebody's DNA, which is nonsense. All right. The mRNA, they take a piece of the RNA, of the,
nanotechnology.
Yeah, and then that teaches your own body cells to actually produce the spike protein, which spike protein, once the immune system picks it up, thinks that it's the full virus, and fights against it. Nowhere does that mRNA go into the nucleus where the DNA is. So they use that information because not everybody understands, where the DNA within a body cell, where the RNA is, and all of those kind of things. So they take something and then they just confuse it like that. So it is therefore important that those who are in the know, they actually try and counter these things, because it's easy for somebody who is untrained in that field to believe some of these untruths.
Well, I'll leave you with that topic, is that there's a video that is circulating about some doctors. It's actually edited, because I've seen the original video of where they're saying that, oh, we'll use the vaccine, we'll start it in Africa so that we can wipe out the African population,
But I mean, vaccination, because we're going to be talking vaccination now. Vaccination, of the 90.8 million shots that have been given as at last night, all right, as at the end of the 30th of January, of the 90.8 million shots, which is the biggest vaccination campaign in the history, 62 countries have already administered this COVID-19 vaccine. All right. In Africa, there hasn't been one country.
Not even one.
Right? There hasn't been not even one country that has started vaccinations. Globally, the vaccination is at 4.39 million every day, globally. Now, when we come to you guys there in the US, as at the as at the 30th, which is yesterday, 28.9 million people in the US have been vaccinated. All right. Obviously, there's a difference from state to state. And this is information coming from the data from the states and also from CDC. Right. And you guys started vaccinating on the 14th of December. Right. 14th of December. And in the past week, you've been averaging 1.3 million doses.
Daily.
Right? 1.3 million doses every day in the past week, using the two, Pfizer, BioNTech, and Moderna. All right. And when one looks at, number of people vaccinated per 100, because it's important to also have a balancing thing, compare apples with apples. As the US, you've been giving 8.8 doses per 100 people. All right. That's how you've been doing. And 59% of the shots, that have been delivered, or 59% of the stock that you have of the vaccine has been delivered, So you're actually making progress, although the rollout is uneven, and most doses that have been given have been via hospitals and other healthcare institutions within the initial round. Okay, so as US, actually, you have already, you are out of the 90.8 million globally, about 29 million are from the US. And I'm sure by the end of today, those numbers will have increased by about 1.3 million. All right. So the vaccination program is actually on track. All right.
So, but let me say this. One day I was listening to Bill Gates. He was being interviewed by George Stephanopoulos.
Yeah.
And they were going back and forth about the vaccine, and he was interviewing him about the vaccine. And he actually addressed, that
that question about the chip.
Yes, yeah, he actually addressed it. But I remember his last question from George, that what is your hope? What do you wish that would happen to this vaccine? So he said, which is actually what you just kind of like addressed. He said that his hope is that the vaccine actually gets to the underdeveloped countries as soon as possible, for them to be also just as priority than, over the, the westernized countries, the developed countries. But we have not seen that happen.
Yes, no, we've not seen it, but I can say that on the 1st of February,
yeah,
right, we will have our first consignment arriving in this country.
I know, I heard.
It is the vaccine from AstraZeneca that is coming from the manufacturers in India. So first of February, we're getting our first lot of vaccines, and that will be for the healthcare workers. We're getting something like 1.5 million doses for our healthcare workers, which is the first phase, which will be followed then by people with comorbid disorders, people who are essential workers like soldiers and police, and also people who are 65 and above. So we're getting there slowly. But the point we are making, though, for the continent, for all these 54 countries, there's not even one at this moment that has started vaccination. And part of it is the fact that the richer nations have ordered so much for themselves to a point where it's a challenge for the underdeveloped nations like in the continent of Africa to be able to source these, but also the issue of resources. I mean, there seems to be, because if one looks at the cost of these vaccines, the Moderna and the Pfizer one are the most expensive.
Expensive, yes.
Very, very expensive as compared to, for example, if I use the South African rands, because I don't know, the Moderna is 536 rands per dose. All right, in rand terms. All right, you can convert it to the US. The Pfizer one is about 300 rands. All right. The AstraZeneca one, which is the one that's coming in, is 54 rands. All right, that's about $3 or $4 USD. And the J&J one is 153. So 90% of what we're gonna get is from AstraZeneca and J&J. 70% AstraZeneca, J&J 20%. So what you guys are administering is a bit unaffordable for us this side. 536 per dose. If you divide that by 16, I don't know what you're gonna get, which is the rand dollar exchange. And the Pfizer one at 300 rands, divide that by about 16 as well. You see, so but just from the number that
300 rands equals to $20, like random.
Yes. Yeah. So the big barrier, therefore, for us to use the vaccines that are vaccines of choice for you guys there in the US is the cost.
So let's
if it's a challenge for South Africa, then it is gonna be a challenge for the
rest of the countries.
Yes.
So, but let's correlate that with the conspiracies. How the Western world, the developed countries are actually like administering the vaccine, and then doesn't that actually
prove
to people that the conspiracies of like, oh, this is to use to wipe out the Africans, while none of the African countries have been vaccinated.
Yes.
So what does that do to that conspiracy?
It kills it. The facts don't go hand in hand.
Exactly.
And they're not going to create a different vaccine to the one that you guys are actually getting jabbed with there in the US. All right. So, but they are saying though that since the 14th of December to about the 12th of January this year, at approximately month, things were not moving very smoothly. There was a rocky start in terms of the rollout up until on the 12th. Up until on the 12th, there was communication that you guys must prioritize the 65 and above and also 16 and above if there are comorbidities, which is then something that has made the numbers to go up a little bit.
So look, you know, the leadership that we had, you know, as I've said, our former president, you know, he literally went for 32 days without ever uttering the word COVID or pandemic in any of his addresses, you know, and the pandemic was not his priority, you know. And I mean, we've seen it so many times where, you know, he would just be addressing, you know, the election over the pandemic. Fine, the election was also important, but we also had, you know, a heavy, situation, which was the pandemic, which was killing people daily, you know. So, and you know, for me personally, I thought that his approach was going to be different after he survived the COVID, but no, he still didn't. So
we were hoping for the change in heart, just like the guy, Boris Johnson.
Yes,
you know, with Boris Johnson, after he survived in the, after being in the ICU, when he came back, the denialism had gone out of the window.
Gone out of the, you know, but you know, we didn't see that. But let me tell you this, Chris Christie, actually, who happened to be the former governor of New Jersey, he was actually with him, and he actually got the COVID, and he ended up in the ICU. He had a different message after he you know, fortunately for him, survived the COVID. He had a different message, and he was actually addressing the president in a different format, you know, and how the president was addressing the country. So, and also when you're talking about the 12th, you know, the 12th of January, there were a lot of changes that happened in terms of, like, he actually, you know, said that, oh, he's finally going to, you know, like welcome the president, you know, and actually get him to meet with his staff. And also, you know, so Biden administration actually had access to, you know, and that was caused by the, you know, the uproar that happened in the Capitol, which, you know, that's a topic for another day.
All right. Now let's zoom in now to New Jersey, because the last 30 minutes, we're just gonna talk to you about your experience. So New Jersey, which is your state, as at last night, they had 727,426 people who had, you know, received jabs. 6.9 million, what is this now? All right, and the daily rate is about 33,821 per day, right? In terms of the doses that are administered. Of the supply, you guys have used 59.1% of the supply that is dedicated for your, you know, for your area. But there are other, you know, states that are doing quite a lot, like California, 3.07 million doses that have been given. Texas, 2.2 million doses. Florida, 1.88 million. New York, 1.78. And the federal entities, you know, the Veterans Health, Department of Defense, Indian Health Services, Bureau of Prisons, collectively about 1.4 million. All right, so your state is not doing badly, but it's not doing very well either. But anyway, let's leave it at that. So you got vaccinated. I saw a picture of you on Facebook.
Not on Facebook,
was it on Facebook?
WhatsApp.
On WhatsApp.
I sent it to you directly.
Oh, okay. Yes. Sorry, man. Sorry. You see. But anyway, I saw you getting vaccinated. I was jealous. I was jealous because I can't wait for this vaccine to get here. So, you know, to see somebody from this part of the world originally now in the US getting the jab, and I was like, I wish I can fast track this thing so that we get vaccination here as well. So, yeah, can you just talk to me about your thoughts around vaccination now as an individual, as the mother, as a wife, you know, as a professional? Now, just the thoughts around vaccination in the midst of a lot of hesitancy out there? You know, what made you to decide I am going to do this thing? And how did you then get to actually, you know, be at a point where you are given that vaccine?
Okay, so now the tone changes. So uh, I live in Vineland, New Jersey, in South Jersey, where we're 2 hours away from New York, but we're just as exposed. And I have 2 college students, a 20-year-old and an 18-year-old. So I'm a professor at a university. I am a co-owner with my husband of a healthcare services, Zenith Healthcare Services. We
You are the vice president of Zenith Healthcare, right? Deputy vice president, yeah, vice president.
Vice president, yes, I'm the vice president. My husband is the president. So, so what we do is that we provide services to the senior citizens that are at home, who have been, you know, who can't go to the hospital, you know, to get services, and some of them, you know, have been discharged from the hospital. So we provide, you know, staff who would come, you know, and assist them, you know, in their homes. And that's, you know, subsidized by the state.
Yeah.
We provide also what's called home health aides, where they come and they clean the house and help them with their, you know, just their daily operations, you know, get their medications, order their medications, you know, all those resources. And then it all depends on the level of, you know, healthcare needs that they have. Also have what's called a licensed practical nurse, and then the registered nurses. So where I come in is that I'm, you know, the operations of the healthcare. So whenever we're having a new intake, I go with the RN, you know, and then I do the administration work. So I am at this disposal of the, you know, the senior citizens. Most of them are, you know, are sick.
Yeah.
And I do the intake, the administration part of the intake, and then the RN does, the registered nurse does, you know, the clinical side of the intake. And also, but, you know, just the whole clinical part, and also check, you know, the environment, you know, and all that. So actually the registered nurses get their vaccines from their, you know, institutions. So that's why our, you know, institution, which is under the healthcare services, we had to get, you know, vaccinated, because we do, you know, the home visits whenever we have new intake, and then we also do the 30-day, you know, evaluations.
So you are in a way in the front line.
Yes, the frontline worker. Yes, yes.
All right. So you are a frontline worker. You are not necessarily a healthcare professional, but the work you do supporting elderly makes you to be somebody who is actually in the front. In fact, last week I interviewed a colleague who is in Manchester in the UK, and one of the mistakes that the UK made with COVID-19, not necessarily the vaccination, was that they did not put in, you know, in place proper programs for the senior citizens, such that the mortality rate was quite high, you know, in that group. So now that is the vaccination thing. The senior citizens are now first in line. Healthcare workers, they come just after. All right. So basically, if you were in the UK, you would have still been in the first line as the people who are, you know, providing that type of to the senior citizens, so that you don't come and infect them, you know.
So, okay, you also asked me a question, what made me to decide? So let me say this, Doc. From the time that the vaccine was mentioned, I said to my husband, I am going to call, you know, whatever company that is doing, I'm going to be one of the volunteers. Before even the approval, I believe in science, you know, and my approach is a little bit different. So this is how I reason.
Yeah.
I believe that, you know, God provides us with a brain that gives us the capability to create, you know, all these medicines, the vaccines, you know, and all that. I actually said it to a friend of mine, and who is based in South Africa, who said that you'll be the last one to get it. So I said, that, well, for me, I believe in God, but I also believe in the vaccines. And some people might think that that's a clash right there. I truly believe that God, blesses, the doctors, the scientists with the brain that would, have the, capability for them to, create the vaccine. So I truly, truly believe. I grew up with a cousin that the parents didn't give her a polio vaccine, and she had polio. So, I truly believe in the power of vaccines. And I gave my children Gardasil when they were of age, to Gardasil,
Yeah, let me explain what that is. Let me explain quickly. Gardasil is a vaccine against the human papilloma virus, right? Human papilloma virus, which is responsible for 90% of the cancers of the cervix. So if you have a child from the pre-sexual stages, from 9 to about 13, it's important that they get a Gardasil, because it's one cancer that you can prevent by just giving those 2 doses, of that vaccine, so that you can worry about other cancers, but at least this one you don't have to worry about.
Yeah, sorry about that. Thank you for the explanation. So for me, right, I've been asked by so many, why are you taking the vaccine? And I say the same way that when I have a headache, I take Tylenol, and I understand that we didn't have enough time to, do a research on this vaccine. But the technology is way advanced than during the flu vaccine that was in the 1918.
The Spanish flu.
I'm sorry, and Spanish flu. It's way advanced, and that is why this vaccine was, proven and was, developed, within a short period of time. So that is why I truly believe that, we need to take this vaccine. And I'm not saying this to convince anybody. It's your, personal choice for you to take the vaccine. So my husband and I have taken the vaccine, and when it's my children's turn to take the vaccine, they will take the vaccine. But of course they are adults. They can. My son first said that no, he's not taking the vaccine, but now he's actually saying that he is going to take the vaccine.
All right.
And, I've actually. I have friends that are in the healthcare field that had said that they were not going to take the vaccine, and I explained to them why I would take the vaccine. 5 of them have already taken the vaccine.
Beautiful, beautiful. So just there's some people who are listening to this conversation, via YouTube or Facebook. I'm just going to ask them if they've got any questions to you. Or comments that they want to make, to make those comments, on the comment section, or via YouTube. At this moment, there are no questions or comments, but if there are any, then my support will be able to ask us those questions, because a lot of people are still anxious. Others have not made up their minds about whether they'll take the vaccine or not. So on the day before you actually went to take this vaccine, were there any anxieties? I mean, like all medicines, like, or pharmaceutical products, there are the intended benefits, but there are also potential adverse effects, or what we call side effects. So did you have any worries? Have you been keeping track of, adverse effects that have been reported with these vaccines elsewhere?
So I know that they're just, well, the side effects that I've found out is that you will get fever. People have had just different side effects, and I know that based on your immune system, each side effects for each person will be different.
Yeah.
I actually had no anxiety. I didn't even, I actually forgot that the following day I was taking the vaccine until when we were supposed to drive. We drove an hour to go and get the vaccine, by the way, because there are, you know, like areas that they've designated areas.
The vaccine centers.
Yeah, the vaccine centers. So I had no, you know, no, I was really not anxious. Instead, I was excited that I was going to get the vaccine. And talk about, you know, you that said that you're jealous. Actually, my friend, the one that, you know, who had said she was not going to get the vaccine. So the night before, when I said that I'm going to get the first dosage the following day, she said, well, my last one. So she was actually so happy that she was getting, you know, the second dosage. So for I've just been, you know, as I said before, I truly believe that vaccine is
take us through.
Work.
Yeah.
And take us through the
on. Now you got to the room or whatever, you know, was there a list that you had to pre-register and then they call you or whatever? Just a little bit about the process.
Okay, so because we are healthcare agents that is registered under the state, so the state sends you know information that you need to you register, you know, so that when it's your turn to, you know, to get the vaccine, or you and your staff, your employees, you know, you know, then you'll be notified. So we registered when that email came out. There's a link that you have to register through. That's only for the organizations, you know. So we registered through there using our organization with the tax ID, you know, and all that. And then we had to state the number of employees that we have, right? You know, the whole, you know, company's details. So, and then we got the email Tuesday, and we went to get the vaccine Thursday, yes. So 10 days ago, we got the email that, you know, we've been approved. So, and then we got, you know, some attachments where we have to fill in the forms, which were very, very detailed. You know, your date of birth, you know, all those, and then also, you know, your health history, which was in detail. You know, have you ever had a reaction? You know, allergies, are you allergic to any vaccines? Have you ever had any allergic reactions to this? You know, what lists the food allergies, you know, every single detail that, you know, that can create some, you know, health hazards. So, and then we filled in that form, and then we send it in through this to the state, and then we got our date. And we went. And when we got there, so the state has, you know, because the universities, you know, are not operating, you know, so what they do is that they use the gyms, you know, the basketball gyms, and they turn them into, you know, like
the gym areas.
Yeah, the gym areas into the health centers. So we went there, and, you know, and you go by appointment, strictly by appointment. And because you state the number of employees that you have, you know, they block a certain period of time that, you know, so we have 8 employees. So we got, you know, 2 hours. And then when we got there, we also had to fill in additional forms. So we submitted the forms with our health history. We got there, they still ask us, you know, have you been in contact with the person with the vaccine? You know, the same, you know, questions. I mean, sort of with the virus. And, you know, and then first of all, when you walk in, they take your temperature. That's number one. And then they record it on a document. And after that, then you know, and then they walk you through in terms of like what's going to happen. You're going to go to around the corner into the room, and then they've created, you know, subsections. So go in there, and then you know, and then you'll get your vaccine, and then they create a card that, you know, that has the date of when you'll be getting your second vaccine. So then
it's done manually. It's not electronic. There's no electronic registration.
No, there's no electronic.
So that data is on a card as you are going.
You mean for when you will be getting your second dosage?
I'm saying as you are getting your dose, I mean your vaccine, the information that's captured as you come
Oh
in,
yeah,
captured electronically, or is it hard
it's
copy?
manually.
Yeah.
It's manually. It's manually. You fill in the forms and then you submit them, and then there's somebody on the side that enters the data into the
Okay.
database.
Okay.
But I mean, you're not like sitting there and filling in everything in the computer like if you will be in your doctor's office. No,
Okay.
that's how. So it's not a live,
Yeah.
database
All right.
process.
So you
So
get the vaccine. Who is giving you? Who's the vaccinator? Is it a healthcare
the
professional?
rate. So what happened is that there was a call, a heavy call for, where the registered nurses who are, interested in being the ones that are administering the vaccine. So it's mainly registered nurses. You can see it from their badges that, the person's name with the RN next to it. And also, they also had a heavy call on retired registered nurses if they're interested in volunteering, or also not volunteering, on working to be administering the vaccines. So, and they give you the vaccine. It had a pinch.
Yeah.
And then the next thing is over.
Yeah.
You want me to go onto what I experienced?
Right. All right. No, that's fine. So,
Mhm.
because we're looking at reassuring people. I mean, when you are
Mhm.
giving, even though you have never had any reaction or major reaction or shock, but there's a period of observation after you've just been given the jab.
Which
Just to make sure that you don't get into anaphylactic shock or other funny. So was
15
there?
minutes.
Yeah.
Yes, 15 minutes. You have to sit down for 15 minutes after you get the shot. You have to sit there. There's somebody that's monitoring, the patients that have just gotten the shot. And then you have to stand up, and then they take your temperature, and then you leave after 15 minutes.
Yeah.
They don't just get the shot and then you go. No.
Yeah. So it's been how many days now since you got your shot?
2 days.
And how has the 2 days been?
Okay, so let's talk about that. And I'm
eh?
gonna keep it real. I'm gonna
Please,
say it like it
please,
is.
yes.
You know that I'm a strong advocate of the vaccine, but let me tell you, my arm, I can't even lift it. That's as far as I can lift it. It is so painful and so heavy. So last night, actually in the middle of the night, the reason why I responded to your text is because I had to get up and put ice. It was so painful, so sore, and I just had a minor headache because I had it. What time? It was at 1 o'clock, 1 p.m. Eastern Standard Time. The time now is like 11:18 Eastern Standard Time, a.m. So it's just been probably 46 hours since I've had it. So I had just minor headaches around about 6 o'clock, and then they went away. I didn't take anything for them. Then they went away. And then yesterday morning, I had a temperature of 101 degrees Fahrenheit.
Yeah.
And I didn't take anything for it. The temperature lasted like 2 hours, and then it was gone. So, and all these were expected. They did tell us that you will have, some minor headaches, your
And at the injection site, there will be a little bit of pain there. Yeah.
Yes. Yeah.
All right. Just there's somebody who just there's just a comment that has come through from one of our viewers from Naniwe Matletuga. She says the vaccine is a no-brainer for me. I'm recovering from the ruthless COVID-19, and I wouldn't wish it on anyone. So that's a nice positive message coming from Nani, basically saying, I've experienced this thing. I don't want to have it again, and I'm gonna put up my hand as amongst the first people to, to have this thing. I've got no questions about it. Yeah.
And I would really encourage people to do their research. And, if you, Doc, who is, a very good resource, put up, the website on, how people can get the correct information about the vaccine. And, and then people, should make up their minds on, whether it's beneficial for them to get the vaccine or not. But
Yeah.
I mean, I'm also so happy because I just found out yesterday that after mid-April, they are going to start, the teachers. They are going to be vaccinating the teachers. And then Dr. Fauci said that there hasn't been any research done on the children and the vaccine.
Yes.
Yeah,
Which is why they will not include the under 16s, but they will progressively go down the ages, until they get, because again, those age groups were not included in the phase 3 trials, that were for the approval, of this thing.
Not to take you off topic, there were so many, concerns, within this vaccine, because they didn't do so many trials on others, specifications, trials like, people with lupus, and I have a friend of mine who is a nurse practitioner who has lupus. So she decided to wait. And thank God she has a private practice. So she decided to wait on, getting vaccinated. And she still has not gotten vaccinated, actually. And then also there's no studies on, the vaccine and the pregnant women.
Yes.
Yeah.
Even here, pregnant women and under 16s are not included as yet, up until there is solid research evidence on safety issues and also efficacy issues. Yeah.
And I mean, for that, they are really, really being careful, and also they are very transparent in terms of, who has, been involved in the trials, and who has not. So it's not like there are some hidden, information that they are not bringing out. Yes.
Let me ask you a question, though. I mean, you guys are using two types of vaccines, Pfizer, Pfizer BioNTech, and then there's Moderna. All right. Both of them around 94, 95% efficacy. And also both of them, they require some serious logistics in terms of the cold chain, because with the Pfizer one, you need the thing to be at minus 70. That is, in terms of degrees Celsius. Now, if you convert it to Fahrenheit, I don't know what it is that side. And also the other one by Moderna, it requires minus 50 if you want to keep the vaccines for up to 6 months. But if you want to keep them for 30 days, then normal
room temperature,
normal refrigeration temperatures are actually okay. So now, if you then look at a country like South Africa, where most of our cold chain is, 2 degrees to 8 degrees Celsius. Now, to be able to come up with minus 70 degrees Celsius, or even minus 50 for the Moderna, it's going to be a tall order, from a logistics point of view.
Yeah, it's and you know what? That's why, just getting the vaccine, and I'll just address it to, South African Department of Health, whoever is in charge of bringing the vaccine, is that you also need to look at, the whole, logistics aspect of it, and also the whole chain of, what is needed, to actually have the vaccine and maintain the vaccine also, and, to just, make sure that the vaccines are kept in the correct, temperature. But it also requires, a heavy investment, because just bringing the vaccine is not the end of it. There's also a whole lot of
distribution and storage, distribution, and all of that.
The whole that, and I understand that, there are so many challenges in South Africa. So also, let me bring this up. I was listening to CNN, no, actually MSNBC, the night before I was supposed to get my vaccine, and a medical doctor from Beverly Hills was being interviewed because he's facing a lot of challenges that the celebrities are offering him $50,000, $20,000 to give him the vaccine. And, nobody in the private care has the vaccines,
Yeah.
And I'm hoping that, when the vaccine comes to South Africa, a lot of people are not going to be, like tempted by all those,
Jump the queue.
Yeah, because, you have people that, really need the vaccine and that really deserves the vaccine. And hopefully we are all going to get the vaccines in a timely manner.
Yeah, there is a comment from Tembeni Mshongo who just says, thank you for sharing, Doc. All right. So people
You're
they
welcome.
like your thing, your story around taking the vaccine, even you being honest that your right shoulder
Yes.
has been sore
Yes.
for that time,
And
Yeah.
and you know what, as I said, that it was my husband and I and 8 of our staff, I think it's only 3 of us that have complained of like the sore shoulder.
Yeah.
The other ones have not had any, side effects, nothing, no temperature.
Do you know which of the 2 vaccines did you take?
Moderna.
Was it
Moderna.
Okay.
Yeah, Moderna. Yes. They tell you, they're not hiding anything. They tell you right there that, you'll be getting the Moderna,
And then when are you due for your second dose? Was it
on the
supposed to be
25th,
about 3 to 4 weeks?
on the 25th. So the Pfizer is after 3 weeks. The Moderna is after
4 weeks. Yeah.
Yeah. So on the 25th of February, I'll be getting my second dosage.
Lovely. The colleague I was talking to last week from the UK, the big challenge there now is that they just want to have the first dose for everybody, and they are actually delaying the second doses to something like 12 weeks, which is not in line with the recommendations of the manufacturer.
Yeah.
And so you may have a lot of people having the first dose, but they will not get that 95% or 94% effectiveness because of the delays in getting the second dose, which, at least I'm glad to hear that in the US, they are actually sticking to the recommendations of the manufacturer.
Yes. Oh yeah, and as I said, that my friend got her first dosage on the first week of January, and she got her second dosage, on Thursday too. So I have not heard of anybody that got the first dosage and was not able to get the second dosage. But I don't know if you can see, on TV, there's long lines. People are lining up, for the vaccine, and they're not. But and now that the administration is on top of it and is actually working to literally make sure that all the the vaccine dosages are out there, taking them out of the storage into the people's
into the arms of the people.
Yes, into the arms, which is where they're supposed to be. So it's actually very, very and you know what? I'm not, as you heard me praising the Trump administration on what they did to put things in place. The Biden administration is moving along.
Yeah. All right. We have only 2 minutes to wrap up, so I want you to just your closing remarks to people here at home. Words of encouragement or any words of wisdom for our people here as we wait for our turn to get the vaccines going. First, first stock coming in on the 1st of February from AstraZeneca. All right, from India, but it's the AstraZeneca type of vaccine that we will be giving, which has got an average efficacy of around 70-75. Much lower than what you guys have there, 94-95 of the 2 vaccines that you have there. But from an affordability point, the AstraZeneca becomes something that's much, it's about $4, and you're getting about 75%, protection. So not too bad, not too bad. It's certainly better than what came out of Johnson and Johnson
Johnson and
yesterday,
Johnson,
which
yes.
in the South African context,
62%.
it's 66 on average globally, 65 for you guys, and 57 for South Africa because of that variant.
Oh, yeah, yeah.
However,
yes.
it still does give
Yes.
85% protection against severe COVID. All right. So in terms of dealing with severe morbidity and possible mortality, it's still very, very good. But general efficacy is definitely lower than all the three that have come before it. So any words of wisdom?
Well, for me, I would, as I said before, that I would really encourage people to do their due diligence and do their own research and just find a reliable, portal and, to get your information, and try to not get the information from people that are sending you their WhatsApp posts and and all that. I know that there are so many social media portals for information, but just do yourself self-justice, and just get information from, I mean, you can even go to AstraZeneca's website and get the actual information from there. Pfizer, and also Moderna as website from there, from the website. I mean, right now, information is at the tip of our, fingers. So, I mean, for me, right, I did, the research, and I did it thoroughly. And, I asked questions, my doctor, I asked him questions. And then I also seek for second opinion. And so just do yourself that justice and just, find out and get the information. And I encourage, everyone to do that. And then if you are satisfied with the results, get yourself registered, and so that you can get the vaccine. Because I am not, going to let this, vaccine win. I mean, a virus win. I still want to, enjoy the rest of my life, and I want to go home too, and visit my family. And my mom is also logged in. So, so I'm really, really encouraging everybody, to register and get the vaccine. That's just, I'm not forcing anybody to do so just because I've done it. I'm just, saying that we need to get vaccinated so that we can move on with our lives.
Yeah, I mean, if there were no vaccines, we would still be battling with smallpox. Smallpox, which was a problem from 1959 up until 1979 when it was eradicated. And that eradication was as a result of massive vaccination. All right. In the African continent, we've now, got polio, to a point where there are no new cases. The last cases were somewhere second half of the year in Nigeria. But for the last 6 months, there hasn't been any new polio cases. And again, it's because of vaccination. So the African continent now has no polio. So we would still be battling with polio if there wasn't any vaccination. So really, I think people need to balance these things. Yes, there will always be side effects whenever there is a pharmaceutical product. And, a vaccine is a biological, a preparation that is meant to give you artificial immunity. And there will be a few side effects, but if you are somebody who has got allergies, make sure you tell, so that you don't have anaphylactic shock, which is the only thing that's really nasty that can kill a person. Otherwise, other side effects are not so hectic. Yeah.
I mean, and also there's something foreign that is entering your body. So, your body is going to react on it, So, I mean, it's no brainer that, you might have some side effects, and our immune systems are all different. So we all react differently,
All right. I know there in the US, they don't know these things, these things called clan names. I'm gonna just to remind you of home, as your mom is listening, that Madlamini, Zizi, Chamakasi Chatu, Mapeche, Panise, Binoboya, Fakate, ndaba ezithethwa insuku ngentsuku, Bhengu noNyathi, you know, those are just, you know, when we are actually trying to get you to feel good about yourself, we call your clan names. So thank you.
Thank you. Thank you. It was my pleasure.
Thank you.
No, I'm always connected to home. I am always connected to home. Actually, last year was, you know, one of the hardest years that I could not go home. But you know what? It's okay. It was, you know, just better be safe than sorry, you know.
You must have been very anxious when Nelson Mandela Bay, PE, was the epicenter of the second wave, you know?
That was very scary, you know, and I have parents that are over 70, and, you know, I mean, the good thing is that, you know, they're fearful of the virus, and they do what they're supposed to do. Yes. So, and I'm so grateful that I still have my parents, you know.
A message to your parents, Kengu.
Oh, okay. Oh, well, oh my goodness. I just want to tell my parents that I really love them and I'm truly grateful for their support. And, you know, I see that, you know, they're still logged in to listen to me, and I love them so dearly. And I am here, you know, because I live in the United States, I live in New Jersey, but as you know, that I always have a connection with South Africa, and I love my country so much.
Yes, but then you are married. You also married to hubby
a Nigerian.
From Nigeria. So please, a message to the Nigerians who have.
Yes. Hey, and you know what? COVID is really climbing up in Nigeria now. So one thing that I'm going to promote in Nigeria is mask. You know, mask up, please. It's very, very important. You know, social distance, and also let's cut the, you know, the funerals and the wedding gatherings, you know, because this COVID is and you know, and it's really killing people. Let's also not wait until it hits home, you know, before we, you know, we start taking it seriously. Just, you know, use other people's experiences by just, you know, personalizing it. And also, if you are, you know, masking, you're protecting yourself and others too. You know, that's the whole, you know, notion about this pandemic, is that fine, you can say that, oh, you don't want to wear the mask, but, you know, it doesn't only affect you, it also affects others too. You might be, you know, a youngster that has a good immune system, and then you bring it home, you know. So that's
because Nigeria is number 6 in the continent in terms of the load. They have 127,000 cases with about 1,547, you know, people that have died from COVID-19. But like you say, in the past few weeks, the numbers have been rapidly increasing, and because it's the most populous country in the African continent, it can actually grow quickly, like, you know, wildfire. So it's important that people adopt those non-pharmaceutical prevention measures to make sure that the numbers don't go up as quickly as we have seen here in South Africa.
Well, I mean, let me say this. Let me bring up something which I know that Nigerians know about this, is that the COVID tests in Nigeria are not, you know, as available as they are in other countries. So people die and they wouldn't even know that they died of COVID. So those numbers are actually not accurate, and I'm saying that because that's, you know, the facts that I got from the medical doctors, and also the Health Institute in Nigeria, which is based in Abuja and in Lagos, that, you know, they don't have the resources.
So there's a lot of underreporting, basically.
Yes.
Right. Yes. So the picture we see is
it's not the actual real picture.
Yeah. But unfortunately,
and let me say this before we leave, that, you know, it actually brought in some people's attention when my husband's uncle, who died on the second week of January, who was a governor of a state, the first governor of Imo State. He died of COVID, you know, and he can't even get a state funeral because, you know, he died of COVID. So most of the people started, you know, like believing that, oh my goodness, it's actually in Nigeria, because a lot of people were actually saying, oh no, we don't have COVID in Nigeria. You guys keep it in America, right there.
Yeah. Okay. All right. But thank you very much, Amanda, once again. I know that we're supposed to have had another discussion, but things didn't work out. But it's okay. You've given me 90 full minutes of your time. It's still morning there. It's a Saturday morning, and here we are in the evening. Thank you very much. And, you know, we appreciate, you know, to get a sense of how things are happening elsewhere. You know, I always say people with wisdom are those who learn from the experiences of others. So there's a lot that you have shared, which is wisdom about how things are going that side. And it would make us, or it will make us here in South Africa to do things slightly better, because one is able to influence things here and there. And so, yeah, let's continue to
the dialogue.
Exactly.
Yeah, the dialogue needs to continue. And I mean, I know that South Africa is going to also learn from American, you know, the United States mistakes, and try to, you know, not to, you know, apply them when the vaccine is there. Yeah. So thank you, Doc. It's always a pleasure. Okay, bye-bye.
Sure.
Thank you.
All right. Thank you to everybody who joined us via the various social media platforms. We appreciate your time, and may you continue to have a safe and healthy, you know, life. This COVID is serious. It takes lives. We must continue to prevent ourselves from getting infected. Thank you. Thank you.
Thank you. Thank you, Doc.